My name is Lanisha Yolden and today is the 11th of the 10th, 2018, and I'll be showing you how I do a surgical admit with a client and her pet for a dental scale and polish today. Hi Tiana, how are you? My name's Lanisha, I'm your surgical nurse today.
Hi.
Yeah, we got mittens here.
Yes.
Awesome, and we got a weight today as well. That was 3.9. Is that correct?
Yep.
Awesome. All right, so we're a little domestic short hair female. Awesome. Now, is your contact number today ending in 400?
Yes, I'll have that
Awesome.
on me all day.
All day. Alrighty, and we're still at Hendale Court.
Yep.
Awesome. Alrighty, so I'll just go through a few just health things with you, obviously, before we get started with the anaesthetic today. Any vomiting, diarrhea, coughing lately?
Nope.
Any known drug allergies other than preventatives?
No.
Awesome. And she's not on any medications?
No.
Alrighty. And she's any illness, injury or sickness lately?
No, she's been good.
Good. Awesome. And doesn't suffer from epilepsy?
No.
Alrighty. What time did she last have her last food? Was it last night?
Yes, yeah, at 5 p.m.
5 p.m. Awesome. And what time did you take away water?
This morning,
This
just
morning?
when I woke up, which was maybe 7 a.m.
7? That should be fine. You just may need push it back an hour or so. Obviously, you just make sure it's down the system there. But
Okay,
obviously,
but that's all right?
yeah, no, that
Okay,
should
cool.
be fine. I'll relay that, but to the vet, that will be, yeah, obviously it's at his discretion. But that usually be fine. We'll just usually push it back an hour or so.
Okay.
Now, in terms of obviously we're getting a dental procedure today, if prior to our examination a couple of days ago, it didn't look like there were going to be any obvious extractions. However, sometimes when we get in that mouth, start probing underneath that gum line and those roots, things can change. So obviously, if there's any diseased or rotten teeth or compromised teeth at all, are you happy for us to take those out today?
Could you give me a call?
Yeah, no,
first?
definitely. We'll
Okay,
give you a
great.
call. That was my next question. Now, obviously, in terms with that, if that is the case today, there is going to be additional costs associated with obviously that surgical time.
Yeah, that's
But obviously, if that is the case, we'll give you a call and give you a bit of rough idea. Now, in terms of obviously your Best for Pet member, which the blood test today includes that cost, so there's no additional cost for that. So we will do that before we give any drugs today, obviously,
Okay,
to
awesome.
have a look at what those kidney and liver is doing, as well as her clotting factors, etc. Now, obviously, we'll give you a call if there's any elevations in that. Otherwise, we'll be quite happy to go ahead. Now, in terms of intravenous fluids, we'll obviously do that as well, pre, during, and post-op. That's included in the scale and polish cost as well. And like I said, because we are a Best for Pet member today, we are entitled to obviously that benefit of $250 off the dental. So if all goes all good today with no dental extractions, we're only looking at about $200.
Okay.
But we'll obviously give you a call if anything changes in terms of that. Now, we're pretty much up to date with everything I can see on her file. Now, did you want us to do nails or any of the nitty gritty things while she's asleep
Oh,
today?
that would be great, as much
Yeah.
as possible.
Yeah, we'll do what we can today. Alright, so obviously you said you would be on that number all day today. Just making sure I've got everything here. So we'll give you a call once she has woken up from her anaesthetic and just let you know how she's gone and that she's okay. And at that point as well, I can make a discharge time with you. I like to say
Okay.
between 3 and 5, obviously depending on what time she wakes up. Alrighty, so if you could just sign print and date down the bottom there for me and just read obviously the terms and conditions here. And then that's pretty much everything. Did you have any questions for me today?
I was actually wondering, like, what is it that's made her teeth this bad? Is it the food that I'm currently feeding at
Yeah,
home?
so yeah. So as I think I spoke to your maybe husband about it, about her previous diet, obviously just being on those 10 foods, and then I've obviously transitioned her over to that TD diet, which is that
Okay,
dental biscuit. But I'll talk more about that on discharge and really get onto that. But we're gonna get her start from the beginning now, get them all back to
Okay.
normal, and then we can just maintain that. Alrighty.
That sounds
Well, we'll speak to you soon.
Thank you.